So as infections run rampant, we're now firmly in level 3 lockdown. President Ramaphosa saying that super spreader events are of growing concern. It comes as hospitals near capacity, and there is also a reported shortage of oxygen. I want to talk now to Professor Ian Sanne. He's the Divisional Head at the Wits Clinical HIV Research Unit, Chief Executive Officer of the Right to Care organisation. Professor, good afternoon to you and welcome. The new measures that were announced last night, do they make sense to you? Previously, you've warned, I think, of tougher regulations in the offing.
Yes, Jeremy, thanks for your interest as usual. I have the introduction of these regulations, particularly the increased level of lockdown, the reduction, the increase in curfew times, and I think doctors across South Africa were all calling for more alcohol restrictions.
Do they go far enough, and have they come too late, I wonder?
So Jeremy, I think far enough at this point in time, if the South African society actually does now pay attention and starts really doing the social distancing, masking, the ventilation of closed spaces, and hand sanitizing, we can turn this epidemic around again and give the health system an opportunity to catch up and not be overwhelmed.
Professor, were you disappointed last night that there wasn't further clarity on the arrival and the distribution of a vaccine? Initially promised in the first quarter of next year, now that's been moved into the second quarter. Government is coming in for some stick. Questions are also being asked about why we're only sourcing this from COVAX and from other sources which we should be tapping into.
So my understanding is that there are bilateral negotiations underway with the various providers of vaccine. I do think that it is urgently needed, and I definitely form part of the group that is calling for a vaccine rollout as soon as possible, particularly to our healthcare workers and to the most vulnerable of our population. I do think the President could have been more explicit on where they are at with those negotiations. It is critically important that we move forward now with vaccine initiatives.
The sense, Professor, is that we've suddenly ended up towards the back of the queue.
I'm not certain that that is true. I think that the Minister of Health is indeed in direct negotiations. I think the unlocking step is for the SAPRA to actually go through the registration process. The only dossier that I'm aware of that has been submitted is the Janssen vaccine, the Johnson or Janssen vaccine, and the others need to now be called upon to submit their dossiers for review by SAPRA. We do want the regulatory framework to be upheld, but we also want that to be done with a degree of urgency to ensure that we now really do get this vaccine out to our healthcare workers. We do not have unlimited capacity of healthcare workers. We are definitely at the end of our capacity. We need human resources, emergency plans to be put in place. I am calling for planning levels to include a further doubling of the number of patients to be admitted, and therefore vaccine to healthcare workers critical to ensure their engagement, their continued and very honourable engagement in this epidemic.
Just finally, let me engage you very quickly then on that issue of capacity. Apart from healthcare workers, we're also reporting on this programme about a lack of oxygen, a lack of beds. Yesterday on lunchtime, we learnt from a senior health official in KwaZulu-Natal that patients were being moved to different districts as capacity ran out at various institutions. Is this, do you think, a spectre of things to come nationwide?
I unfortunately do. I think that we are seeing the increasing rates of COVID across all 9 provinces. The only province that is demonstrating some turn in the number of cases is indeed the Eastern Cape. and in fact, Free State has been in control of their epidemic from the beginning of COVID. Those two provinces are doing very well. The others, unfortunately, are seeing an increasing rates of admissions. On the oxygen side, we've been doing a very detailed oxygen project as Right to Care, funded by USAID, together with Deloitte since July, and have indeed submitted 160 audits of facilities to the Department of Health for facilities that could benefit from an upgrade to liquid oxygen tank capacity. This would offload the very serious shortage of cylinders in the country. At this time, it is quite difficult to understand where between Treasury, Department of Infrastructure Development, and Department of Health these infrastructure enhancements will be decided and undertaken. In my view, they are urgent, and that we would really like the three DGs, the three ministers of those three departments.
All right. So unfortunately, the picture frozen there, but I think we get the gist of it. Professor Ian Sanne, as always, thank you very much for joining me.